Welcome back to Eco Family News. Our next guest is Dr. Hilary Smith. Dr. Smith has been a licensed chiropractor for over 24 years, holds a doctorate in homeopathic medicine, and is a certified clinical thermographer. After 2 decades of service as a successful holistic doctor in the community, Dr. Smith decided to devote her practice to a non-invasive, preventative breast health system known as thermography, and currently owns an innovative thermal imaging center in Studio City, California. Thank you for joining us, Dr. Smith.
Thank you for having me, Kathy.
Well, so tell us, what exactly is thermography?
Thermography is a digital infrared picture, and it's taken with a infrared camera, but it's a medical device. And what we do is we pick up the heat. The camera picks up the heat that comes off of the body, so we're not putting anything into the body. And through these images, we can get information about what's happening inside, and it's pre-structural, especially when we're looking at the breast. We're talking about pre-structural images of physiology, which means that it's things, we can see things that are there before they actually manifest themselves anatomically. So it's kind of function before form.
Interesting. Well, how did you become interested in thermography and preventative breast health?
Well, I think I was like so many other women in this country. We are bombarded with negative information about our potential for developing breast cancer. And my mother had developed breast cancer later in her life, and it was very traumatic. And because you always hear that if you have a family history of breast cancer, your chances are so much more. So I carried this fear within myself that I too would develop breast cancer. And I didn't want to own that. I didn't want that to be my future. And I had started having mammograms probably in my 30s because of my family history. And there was just something about it, this continual exposure to the radiation, but also the compression, which I felt was damaging. And so I was looking for alternatives for myself, and that's when I discovered thermography and how amazing it was and underutilized for breast health. And it fit into my lifestyle, it fit into my health approach. And when I couldn't really find the kind of opportunity in my area to have the thermography myself and the follow-up that I was looking for, I decided that this is where my life had brought me, because I wanted to bring it to other women, and I wanted to help them overcome this fear of breast cancer that I think is pretty prevalent, and also to offer this early detection for women so they could look at their health and make lifestyle changes. And even if it was something that needed to be addressed surgically, we're looking at the earliest detection possible. And so I believe saving lives, because that's what we always hear, early detection saves lives, right?
Right. Well, now, in terms of time frame, is thermography give you earlier detection than a mammogram?
Well, when a mammogram or MRI or a manual exam, any of the other screening tools that you may have heard of, these are all looking at anatomy. The lump already has to be there. But thermography, again, is pre-structural. So thermography can show changes 8 to 10 years before you'd ever find them any other way.
Now, what exactly is pre-structural?
That means before there's actually a lump, when cells first start to duplicate, they need blood to bring them nutrients so that a tumor can grow. It's the only pathology or some kind of disease in the breast is the only thing that will ever change the blood flow in the breast. So when cells start to duplicate, they need more blood to nourish them. And so blood vessels start to grow, and because of the heat that the blood puts off, the vascular changes can be seen with thermography.
Well, I'm very impressed by this. I'd like to share with our listeners that I myself at 50 had never chose to have a mammogram, basically because it just didn't feel right to me, being in this industry and seeing some of the things that kind of stem off of mammogram, whether it's injury to the breast tissue or, just the experience. But, I've been real diligent about checking my own breasts regularly. I eat right, I exercise a few times a week. So, I've never found anything that would prompt me to go have a mammogram. And, maybe if I had found a lump or something, maybe I would have done it. But when I heard about thermal imaging through you, I really, that's what I really like. I like the concept to pretty much what you had explained to me in my visit last week was it creates a baseline picture where you can actually monitor your own body over time. And it's just fascinating to see the thermal images and to be able to discuss that with a trained professional. It's like really empowering. I really have to tell you, I was very empowered by the whole experience.
Even you, Kathy, and I've seen this with other practitioners who have really good health habits, who have very positive thoughts, who don't feel that their thought patterns are lending themselves to creating any kind of disease in the body. After they get their baseline for thermography and they've looked into the future, like one woman said, I feel like I've seen the trailer for the movie, and you know that there's nothing suspicious developing in your breast. It gives you peace of mind, and I think that that's an incredible side effect of thermography, that even if you don't know it, you have been bombarded with this information, and you can just dismiss that negative thinking.
Exactly.
I also wanted to say that some people think, well, thermography is a holistic alternative to mammography, and that's not what I'm saying, because thermography is actually completely different. One is a look at physiology, and the other, mammogram, MRI, it is a look at anatomy. So we may recommend that we don't recommend that people don't do their mammography. People need to figure out their own breast health screening with their practitioner, or, go within themselves, research it, and see what they want to do. But definitely, it's a part of it. If we do find something that looks suspicious, we do have to follow it up and look at the anatomy, whether it's with ultrasound or mammography. So there's a place for everything.
Well, I think that's very poignant in saying that, because, everything has its place. And right. I think that's really important to recognize. So, I also want to...
While we're on that, I just want to say one other thing.
Uh-huh.
We're hearing about younger and younger women in our estrogen-dominant society developing breast cancer. Well, mammography is not effective for younger women. And I'm talking about women, in their maybe late 20s and 30s who have very dense breast tissue. Besides for the years of accumulation of the radiation, the breast tissue is just too dense for it to be very visible. So for these young women, thermography is an absolute no-brainer, because it's no radiation. It doesn't matter that it's a dense breast. And then you get this 8 to 10 years of an early look. And so we don't have to see all these young women developing breast cancer. If they could have this information, maybe they could do some lifestyle changes. So it's especially important, I think, for young women who even aren't the age for mammography to go ahead and get their baseline thermographies.
Oh, I think that's great advice. And so let's say that somebody comes in. Actually, I do want to back up a little bit. I also want to tell our listeners that how easy it was, the experience of going into your office. You basically take off your shirt, you give us a sarong to put around the upper part of our body. You sit down while we're in this robing, and you explain to the patient exactly what's going to happen and how it works, while your body temperature is cooling down, which is really interesting as well, you know. And then you move us to a stool and we gently position our arms either on our hips or above our head and just do little turns on the stool. So the whole process took like a couple of minutes, and the results were back within a few days. And I'm happy to report that my report came back well and good. But as you do with all your patients, I will return in 3 months to really give us that baseline to evaluate my body in the future. I love that. I mean, it just...
The reason that you come back in 3 months is that typically, and of course everyone's different and it depends on the person's age and their menopausal status, but typically cancer cells will duplicate in 90 days. And so we are looking at change over time. So we don't want to miss the opportunity to see if there are changes exactly at the time when they would be occurring. So that's why you come back in 3 months. But that baseline, Kathy, unless you have surgery, is good for the rest of your life. So you get your baseline, and then in the future you just come once a year for your screening.
Okay, well that was my next question, was how often do you come after that? So it's annually. And so let's say somebody does have an abnormal thermography session or picture screening. Then what happens?
Well, I want to say that the system that I use and the doctors that I use to do the interps, they're all MDs that are trained as thermologists, and they're really wonderful. And so when I send the pictures over the internet, because it's a direct link, and because they're digital and they're saved for 7 years for comparison, I get the report back. And you had said it was pretty quick. I'm guaranteed it in 48 hours. And I think, as you experienced, I call every single person to read their report to them because I don't want people getting a report with big words that don't mean anything and getting scared. So not only do we send the report, but I also go over it with you.
Well, I loved getting it in the mail. That was, you know, with these pictures.
Yes. Had they framed up on your wall yet?
Not yet. I'm thinking of scanning them and posting them.
Okay. Okay, that's up to you.
You never know what's going to happen with a journalist, you know?
That's right. The doctors who do the reads, they will make recommendations. So if there's something that looks suspicious and they would like to look at it again in 6 months and not wait a year, they'll make that recommendation. If they feel that clinical correlation is required immediately, they'll make that recommendation. And then it really depends on the person's history, their comfort level. A lot of times I'll send people to the radiologist for an ultrasound. I have radiologists that will do the ultrasound off of the information on the thermography, and that way the person can take a look at what's happening anatomically in their body through ultrasound, which is, you know, pretty benign. There's no compression and there's not radiation.
Right, it's not really that invasive. It's gentle.
But if something comes up highly suspicious, if something is highly suspicious and it looks like there is cancer there, you can't biopsy. You know, only like 10% of what's biopsied ever is cancer. Thermography mammograms can't say yes or no either. Only a biopsy is definitive. Mm-hmm. That's the only diagnostic, really. But a biopsy can't be done off of a thermography. So if a person really looks like they have something suspicious, maybe they have an ultrasound and it looks suspicious, then they're going to need to have a mammogram and a biopsy. So we have to look at every individual thing. But because we're looking so early, it's really exciting to see when people balance their hormones or they do detoxing or lymphatic drainage, different things, that we can actually have an objective finding to see people getting better from their treatment.
Dr. Walker was on in the first section of our show today, and she was talking about, you know, how it was somewhat dangerous, in her opinion, to have a mammogram when there is a mass in there, because then it smushes it and can kind of release into the system, What are your thoughts on that?
Well, I'm trying to really more on the cancer side. For me, I made the decision that there's so many wonderful practitioners and naturopaths who deal with cancer that I really want to be the fearless breast health person.
Mm-hmm.
I think that it's definitely a possibility. I think that when people are cut into, there's danger in that too. There's actually Ralph Moss. He has do you know him?
I don't.
Kathy? Ralph Moss. He's an interesting researcher, and he does have a website, and he does consultations for people with cancer. And he wrote a rather lengthy report about that. And it is a possibility too when a tumor that's encapsulated is cut into. And for young women, it was just an article that came out, I believe, earlier this year, that young women with the BRCA genetic positive testing, that the radiation from the constant mammography, do you know what should we talk about what that is? That's a genetic marker for developing breast cancer.
Mm.
So these girls that are tested having genetic testing and they come up positive, because it looks like their odds of developing breast cancer are higher, they are having a lot of mammograms very early. And there was just a medical study that was done that showed that actually the risk was greater than the benefit of the long-term exposure to the radiation. So anyway, back to your question, anything is possible. There's pros and cons with everything. Except thermography doesn't put anything into your body. It only measures what's coming off of you, and we're not touching you, so it certainly can't hurt you.
Well, that's what I like.
Think that, I think I'm going to stay pro-thermography and let the cancer people talk about that side of it, if that's okay with you.
That sounds like a great plan.
Okay.
And so do you only do breast scans, or can it go beyond that?
I do full body scans.
Oh.
It's exciting. It's really exciting. I just did one this morning, a very healthy woman, and she had a lot of inflammation on one side of her mouth, so we're waiting for her report to come back. But that is one thing I think is gold in the full bodies. When we can see what's going on in the teeth, when there's inflammation in the teeth, because, inflammation is a huge marker for disease, right? Cardiac disease. Mm-hmm. Inflammation's a huge marker. And when people have inflammation and it's hidden in their mouth, maybe under an old crown or something, that inflammation, it just permeates the entire body. And you can start to see over time in thermography, I've seen studies where first there's the inflammation in the tooth, and then it drips down into the carotid artery, which becomes inflamed, and then that creates the hardening of the arteries, the plaquing, the susceptibility to stroking, and then even dripping down that side to either the breast or coronary arteries, leading to heart disease. Systemic inflammation is very dangerous. So we look in the full body, we don't see the brain because the skull obviously is blocking that, but things in the sinuses, muscular things, joint things, fabulous for finding unexplained pain. People have pain and they don't know where it's coming from. They've had an evaluation, they've had x-rays, let's say their leg hurts, but they don't know if it's their back. Well, with thermography, it can help determine where is that pain really coming from, joint, muscle, a deep vein thrombosis, maybe the hip, and it's great for the practitioners that are working with, my thermography clients to know really where to hone in and treat the person. So it's great for finding unexplained pain also. You never know it's going to come up. It's a picture. The truth is in the picture, right?
Exactly. What an amazing evaluation tool this is. It's just, and I imagine that you are not doing men at the moment.
Yes, I have done some bodies on men.
That's exciting because I would think that it would be great for evaluating, early detection of prostate problems.
Well, we don't do the prostate.
Okay.
It doesn't really show up. It's the way that we're able to see the organs is the dermatome or the nerve, the way that the nerves show up on skin patterns. The doctors, the thermologists who do the reads, they're able to establish what organ might be involved. But the prostate's not coming up, and also the ovaries. We can have, if someone were to have a full body screening and there was some inflammation around the area of the ovaries, then I would suggest that they follow up with an ultrasound. But for people who really want to be very proactive, there's easy blood tests for the prostate. That's non-invasive, and ultrasound for the ovaries. So we try and recommend that people do the most efficient, non-toxic kind of screening that they can do. And luckily, there's some better ways to look at that.
So, is thermography safe for women with implants?
Absolutely. We get a lot of patients that have had implants because thermography, as you remember, there's no contact. We're not touching. We don't have to put any pressure or compression on the breast. And also we're relying on temperatures that come off the skin. So it doesn't matter. It doesn't matter if someone's had a mastectomy and we're following their lymph and their other breast, or if people have implants. None of that matters. So it's just appropriate for everyone.
Well, this is great. Thank you so much. Well, I have learned a lot today, that's for sure. And I'd like to let our listeners know, too, that you have generously offered a $25 discount for anybody who books a thermography screening with your center before April 24th. So let's see, you've been listening to Dr. Hilary Smith, a licensed chiropractor, doctor of homeopathy, and certified clinical thermographer on Eco Family News. The innovative thermal imaging website is www.pictureinside.com. Thank you so much, Dr. Smith, both for joining us and the generous discount for our listeners.
Thank you, Kathy. I just want to say that this is going to be women telling other women. That's how the word's going to get out about thermography. This is where we're going to learn about it. So I really, really appreciate you sharing the information with your audience.
Well, thank you. I really believe in what you're doing and the way that you're doing it. And I am your host, Kathy Arnos, and want to thank you for listening to Eco Family News on I Am Healthy Radio, where we inspire dialogue about important health and environmental issues and work towards creating empowered parents, balanced families, and a healthier planet for our future. For more information about future shows, please visit IamHealthyRadio.com. Thank you for listening. Goodbye.